please submit them in the comment section of Facebook or YouTube or whatever platform you're watching, and we will pull it on the screen for him to answer. But first, when did you decide to become a physician and why?
As I mentioned, I sort of had a bit of a difficult path to medicine. So I didn't really decide that I wanted to be a physician until maybe a couple months before I applied. I was sort of torn between being a physicist, being, like a pharmacist, doing some sort of research, whether it's, biologic or pharmaceutical or who knows. And all of the science nerd things were on the table. And I was like, you know what? Medicine really fits me. I shadowed a few of my parents' friends who just coincidentally happened to be anesthesiologists. And I was like, I can do that. It seems like a pretty cool job. And so I just sort of set about figuring out what I needed to do to get into med school. And I was like, oh, I need to take the MCAT. I guess I'll do that. And so took the MCAT and did really well on it. And that's really kind of what carried me. But yeah, it wasn't and I would say even up until I attended med school, I wasn't 100% sure that that's what I wanted to do. But as for why I decided that I wanted to be a physician, this is an interesting question to start off with because I'm going to be super blunt with you about this. So income, right? You're guaranteed a 6-figure income. That's obviously pretty nice perk. I like, the subject matter. Obviously, I like just learning how things work, whether it's in physics. I have a degree in physics, by the way, so that might make a little bit more sense. I just like knowing how stuff works. And what better to figure out than the human body? So I like that. Anesthesia in particular, I chose because I really like pharmacology. I like all of the medicines and sort of the acuity of it. And not to wax poetic on that too much, but it's really, really interesting to me. All of the interactions and between drugs and medical conditions and all of that, I think is fascinating. And the fact that you have to kind of know everything to be good at the job is not to say that I necessarily am all the time, but that's the goal at least. But the other thing is authority and independence. I wanted a job where I could essentially function, without people messing with me, basically. I don't mean to say that I wanted, total autonomy and just to, do whatever the hell I want, but it's nice to just be trusted to do your job and not have somebody totally breathing down your neck all the time and have deadlines and, I have to keep track of what I need to do or else everything sort of falls apart, right? Especially in my situation, because we were, like I said, a small private group. And if somebody sandbags, the whole operation just comes to a grinding halt because we don't have enough people to make up for that. Yeah, there you go.
If you enjoyed this, click the thumbnail to watch the full video or visit Student Doctor Network to see the free resources we have available to help you become a doctor.